So you're thinking about bottom surgery. Well, I've got the lowdown. There's a variety of different ways of doing it, but there's three probably main ways. There is full depth vaginoplasty. So I had a penile inversion. That's where they make a canal out of the shaft of the penis and they flip it inside out. They get rid of the inside stuff. They make a cavity. They use all of the important parts and make a clit. And mine looks pretty good, I think. So that's one part. And there is also what's called a zero depth vaginoplasty. So that's where they don't make a canal. And there is another one called an orchiectomy where just the testicles are removed. There's also one more where they pretty much get rid of everything and there's no real genitalia down there. I think it's called melioplasty. Anyways, that's a very uncommon one, I think, for most people. Very common one is orchiectomy, as the testicles are where the testosterone is made, from what I understand. And so that way you don't have to take T blockers for the rest of your life. So that is something that a lot of people do. So that's that. A zero depth vaginoplasty, if someone who doesn't want to have penetrative sex, that would be a great option. Can still have sexual pleasure, but because there is zero depth, that also means that there is no need for dilation. And now dilation is the big deal when it comes to full depth vaginoplasty, because what you're really doing is you're creating a canal inside the body. So the surgeon has to create a space there for that to happen. And the body doesn't know what's going on with that, right? So it tries to seal up the area. So what you need to do is you need to force the body to leave it open. So what ends up happening is you have to do what's called a dilation. And so the doctor will give you 3 or 4 different sized dilators. And now the dilators are long plastic dildos with little markers on them so that you know how deep you're supposed to go. And then at the beginning, you're supposed to do it a lot, and then over time, it gets less and less and less. So, my doctor, I had my vaginoplasty in Montreal with Dr. Brassard. And so the first month, you have to do dilations 4 times a day. And that means you have to lie there on the ground with a lot of lube and you insert the dildos inside. And usually you're trying to get to a size 4, which is the biggest size. And then you're supposed to get it in as deep as you can comfortably and then push just a little bit further. And then so you're supposed to keep that cavity open. And then you're supposed to leave it in there for, half an hour or so, depending on what the doctor says. And then and then when you're done, that's quite an uncomfortable half an hour, I will say. And then you have to go and douche. So you fill these little water containers with water, and then it's got like a little spout, and it's got like holes all over the place. And then you insert it inside, and then you squeeze it a couple of times to get rid of all of the lube and all of the other who knows what else is going on in there. At the beginning of your surgery, there's probably blood and all sorts of yucky stuff. So that's at least initially. And then, so that part of that is the dilation and the douching. And then what you have to do is you have to lie there with your legs open, letting it air dry. I know, exactly. So that whole procedure from the first dilation takes anywhere up to about an hour, hour and a half. But you have to do that 4 times a day, and not obviously all at once. You have to do one in the morning, one in the afternoon, one in the night, and then one right before you go to bed, because the body wants to heal. And I heal very quickly, so I had to dilate exactly as strictly as possible so that I could do that. And then in the second and third month, it goes down to 3 times a month. 3 times a day, and then it goes slowly down, down, down until you get to a year when you only have to dilate once a day or once a week. And that once a week dilation is something that you do if and only if you aren't having penetrative sex. So if you're doing that, then you don't have to dilate anymore. So I don't dilate anymore. Do the math. Exactly. So I haven't dilated now in many, many months because I don't need to. And because I have a good active sex life. So there's that. Um, and that is what it is like. In terms of appearance and comfort and cleaning and all that stuff, um, it's really easy actually. For the most part, I had zero complications with my bottom surgery. Every morning I wake up just like every other person and I clean myself. So, very similarly, I continue to do that just like I would have before. It's just a different body part. And I can tell you, for me personally, it was a night and day difference for experience wise. The bottom dysphoria just vanished the second I had that bottom surgery. The surgery itself was only about an hour and a half. Um, I was in the aftercare part of the hospital for 7 or 8 days, which was exactly what was prescribed. And the very last time I took any pain meds was the day that I left the hospital. And even when I was there, I wasn't taking it very often. Pain was very minimal, which is surprising because I think everyone expects the pain to be astronomically high, and it's actually very much the opposite. When you first wake up from surgery, you have a stent inside which is holding that space open. And when you wake up from surgery, you don't know what's going on. All you know is that there's a huge packing around that area. And then I think 48 hours after the surgery, they pull that stent out. And then all of a sudden you're like, oh my God, that's what that thing was that I was feeling, that discomfort down there. And then, you start peeing again and they check your bladder and they make sure everything's good. Overall, from all the surgeries I've had, outside of the dilating itself, which is a pain in the ass, it's funny because the first time you do dilation, you're like, oh my God, this is so amazing. And then by the time you get to like the fifth one, you're like, this is fucking terrible. And then you have to do it for a year. Anyways, as an aside, the surgery for me was very easy. I had no complications, no problems whatsoever. I'm sure it does happen, but I had no issues whatsoever in my surgery. Obviously, some people do. In terms of pain, the pain was extraordinarily minimal, shockingly low, which is a comfort for a lot of people, actually, because I think a lot of people, surgery scares them. And it, for me, was a non factor. And now I get to just be myself and my full self, and that's how I found myself to be the most comfortable. So, bottom surgery, it is a big deal for some people. For other people, it's a non-issue. Everyone has to make that decision for themselves and how they feel comfortable. Um, Personally, I knew that that was probably the most important surgery for me to have. Um, and I think everybody makes that individual decision on their own. So, with that said, that was my little bottom surgery talk, and hope you enjoyed it.